let's react to I Went to Turkey for a Hair Transplant by Teaching Men's Fashion.
I went to Turkey for my brother's hair transplant, and in today's video, I'm gonna go through the exact cost of it. I'm gonna walk you through exactly how the procedure goes. And finally, since this happened over 3 months ago, you're gonna get to see the exact results you can achieve from a hair transplant.
3 months is not going to give you a final result. That's usually when the transplanted hair starts to come in. So this shouldn't be the final result if it's truly been 3 months from surgery. Final result can take a year to 18 months.
You ready to show this? Show the hair transplant?
I think so. I think I'm ready to do this hairline.
So much suspense.
So it all started from where I live in Manhattan.
Oh, look at this. He's our neighbor.
From there, we took a direct flight from JFK, New York to Istanbul, Turkey, which is a 12-hour trip. Once we arrived at Turkey, we were picked up in a black Sprinter van by 2 individuals. These guys were extremely nice. They're like family oriented, super nice, always smiling.
Come on, just like everyone in New York City, right?
Here's the interesting part about getting a hair transplant in Turkey versus one in America.
Remember that it's not just about choosing the country where you're going to get the surgery done. It's about choosing a specific clinic, a specific surgeon who's going to be doing your transplant. Oftentimes I feel like that gets lost in videos like this. It's trying to put one country against another, when in reality it just comes down to the surgeon who's, doing your surgery, and then the team that they're working with. At the end of the day is the most important thing.
We didn't go straight to the clinic. Instead, we just explored Turkey, which is a beautiful city full of history, full of amazing architecture, and the best part, amazing food. My bro's gonna get a hair transplant, but before that, we're gonna get to explore the city.
Little tour. Yeah, a little tired, but a little tour.
I feel like some people do like to travel out of the country for surgery because of this, because they do get to explore a new place, and it's kind of combining a vacation potentially with the surgery. So I get the appeal of that. So I'm looking at his brother, and his hair looks really good. So I'm not really sure what the plan is for surgery, but we'll see what they come up with.
I'm not gonna lie, bro. I was nervous, all right?
When I look at these markings, it looks to me like they went straight across with the hairline. We often talk about not taking a hairline straight across, because the thing is, it might look good when you're, in your 20s, early 30s, but how will that look when you're in your 60s, 70s? We do want to think ahead. And there's also the potential for additional hair loss. And we don't want to start too low and too straight across, because that gives a much more juvenile appearance to the hairline. But it looks to me, at least from this angle, and it could look different potentially as we'll see him from the front, but from this profile view, it does appear like they kind of squared off the hairline in a fairly low position.
I'm not big into surgeries. I'm a little scared of them. I'm a big boy, but I'm still a little scared of surgeries.
Yeah, most guys who come in for a hair transplant, that's the first and sometimes only, cosmetic type of surgery that they've had. So it's not like they've been through a whole lot of other procedures, and many of them come in, worried and unsure exactly what will take place.
It's a clean new facility, which helps ease the nerves a bit. It was state of the art.
They're using this type of infrared device to be able to exactly pinpoint, where they want to draw the hairline. The truth is this, that there is asymmetry to the face, and one side is never the same as the other side. Measurements are fine. These types of devices are fine. But at the end of the day, you really need to use an artistic eye to be able to see how to properly frame the face and how to make the new hairline blend seamlessly with the hair that's around it. And that's something that no device out there can give you an answer to. You just have to have the vision for it. And you can see the exact markings. And as I was suspecting from the profile view, when I look at him from the 3/4 view, there is a straight across kind of element to his hairline. It doesn't look like they've left him with too much frontotemporal recession, which again, some people, that's their preference. In terms of the temples, it looks like they're accentuating the temple some. It's a fairly low hairline that they're giving him. His hair even now looks quite good, so they're going even lower. And it would be interesting to also see the horizontal thirds as far as measurements to make sure that the top third is not too short relative to his middle third and lower third. That's an important measure to do when you're trying to decide where to place the hairline, especially if there's a risk of potentially it being too low.
I got a little emotional at this point because I wanted to get down and see how my brother was feeling and why was he going through this, right? Why was he actually going to go through the procedure?
Well, it makes a good YouTube video. That might be one reason.
I'm not the type of guy that will do surgery yet, but I'm 35, all right? I'm losing a little bit of hair right here, so you know I have to do what I gotta do. You can see it's a modern facility, and the best part is, everything's gonna be seamless.
Yeah,
I don't think you should.
Us up, hotel, to here, back to hotel after. Yep. So amazing.
The most important thing when it comes to a hair transplant is having the proper strategy. You know, what is it that you're trying to accomplish with your, say, hairline or any other part of hair restoration? So, you know, these other things, you know, the name of the place, the reputation, how fancy the space is, all of that is in a way kind of a distraction, in my opinion. Proper strategy can occur in Turkey. It can occur in the United States, any other place. Oftentimes, though, I feel like there isn't enough emphasis on like, what's the big picture? Not just the 1 year plan, what's like the 20-year, 30-year plan for you to sustain your hair and also to have it look as best and as natural as it can be. It's not that hard to move some grafts around, but to have the proper strategy for what your plan is, that takes a bit more skill and experience, really talking to patients and figuring things out together.
We went into a pre-surgery room where he could have his first consultation with a doctor.
So I think the initial consultation hopefully took place, you know, before he ever got to Turkey, and not just with the consultant who may or may not have been a doctor, but with the actual surgeon who'd be performing his procedure. I've heard that that's not always the case. Sometimes people fly over and then they finally meet the doctor, you know, day of, if they're lucky. And that to me can be problematic. I think you really should meet the exact surgeon who's doing your surgery way in advance, you know, at the initial consultation, ideally.
His hairline, it was receding. And this is normal for most men because according to a study, up to 50% of men will lose considerable amount of hair in this front area of their forehead.
Yeah, and it's not just at the hairline. Plenty of men lose hair in the frontal scalp, mid-scalp, crown, you know, that whole DHT sensitive zone that we talk about.
After the consultation, the doctor then started examining this area of Juan's hair to see if there were any small hairs left in the areas where Juan was losing it. For Juan, there were still small hairs that couldn't be seen by the naked eye in this area, which this is great news because what the doctor told us is that after procedure, you can improve the benefits of the hair transplant by using topical medication like finasteride and minoxidil.
So I'm glad that the clinic at least brought up these medical therapies that we talk about all the time on the channel. Keep in mind that finasteride and minoxidil, while they are available as topicals, they're much more effective and more potent as pills, and we have the pills available at the feelconfident.com website. We also have topical finasteride available, but the oral form is going to be more potent and more effective for your hair. But the flip side of that is that it carries more side effects, even though for most people at the standard dosages, they do quite well with little to no side effects. So that's just something to keep in mind.
These are the two ingredients that I always recommend you guys use. For example, most of you, if you want the same results, but maybe can't afford a hair transplant, using these two can save your hairline.
He's right about that. The medical therapy is very important, but in a way it's accomplishing two different things. The medical therapy is there to protect the hair that you have and to create that stable foundation. Then you can come in with surgery to do things like put a lot more hair in an area that's been heavily depleted over time, and to potentially put hair where there's never been hair. Some people have always had a high hairline and that has bothered them. That's where the transplant comes in. So they are complementary type of treatments for hair restoration.
If you don't know how a hair transplant works, essentially what they do is that they'll take a hair follicle out from an area where you have a lot of hair.
So we take out what's called grafts, right? So there's two ways to remove the hair. There's FUT, where we cut out a strip. That is a procedure that's still done today. However, it's fallen out of favor for many men because men are trying to avoid that linear scar often so that they can wear their hair shorter. And so now FUE, or follicular unit extraction, is becoming more popular, and that is where we're removing individual grafts. So it's not necessarily one follicle, it's an actual graft, which is a family of hairs or a family of follicles. Sometimes that could be single hair graft, or most often it's at least a 2-hair graft.
Most of the time, doctors will take hair from the back of your head. For Juan, they were going to transplant 4,000 hair follicles.
Okay, so this is something that you need to be careful with. Some clinics will quote you for the number of grafts. Remember, each graft has an average of 2 follicles, and some clinics will tell you the number of follicles. So don't be fooled by that, okay? So 4,000 follicles actually equates to about 2,000 grafts if he's reporting this accurately. So make sure to ask for the semantics. Are they talking about grafts or are they talking about follicles? And also keep in mind that there's a limit to how many grafts you have in the back and the sides of your head before the area starts to look more depleted. So in someone with a very strong donor area for FUE surgery, you're looking at on average about maybe 6,000, maybe up to 7,000 grafts before the area starts to look much thinner. So there really is a limit. Let's say this is actually grafts and not follicles. So 4,000, they're taking more than half of your donor supply and placing it right here. But now imagine what happens if he starts to thin out. Let's say he's not on medical therapy and 10 years, 5 years go by, 10 years go by. Now he's lost a lot more hair. Where are you going to get that hair? You're going to go back there, right? But you've already exhausted more than half for the initial procedure, and now you have a lot more area to cover, and eventually you run out of grafts. So that's where the strategy, the upfront strategy, becomes super important.
Now here's where it gets good. This is the difference between a good facility and a bad facility, because a second doctor stepped in, which is more focused on aesthetics. He then came in to size up Juan's head to be able to draw a natural hairline.
Okay, so you don't need two surgeons to do a hair transplant. Ideally, you have one surgeon who understands the technicalities of where you get the grafts and also the artistic eye for creating a natural hairline. So that is not the distinguishing factor between a good clinic and a clinic that's subpar, right? Ideally, the head surgeon should have both of those abilities.
But what's important here is that they made the hairline look natural instead of making it look super straight, which is where it looks a little funny.
So this is what I was talking about before, and he's bringing this up as far as not making it super straight. I think that this is already quite straight. I understand that there's a little bit of frontotemporal recession that they've kept, and I'm happy about that. But this is still a fairly straight configuration to the hairline. Some patients do want this, so I'm not saying they did anything wrong, but it's something to consider that there is a more recessed version of this type of hairline that may have been possible as well, but maybe the patient wanted it to be a bit more on the straight side. Also, when I look at the markings there, it doesn't look like there's enough space to fit 4,000 grafts. I don't know how they would even come close to that in terms of how many grafts you can fit into an area like that, especially if you're doing the temples. You can start to approach numbers of about maybe 2,000 grafts. So when he said 4,000 follicles, which would be 2,000 grafts, then yeah, that is believable. It's still a lot of grafts, but that is possible, I think, to squeeze into an area like this.
Once all that was done, they asked Juan if he was happy with the hairline. He said it was good, and then the doctor explained what the procedure would look like. They also explained a key point of a hair transplant, where they were not only going to treat the area that had no hair, they were actually going to push up a little bit into the area that had some hair.
I see what they're doing here. They're, spreading the grafts into regions where he already has pretty good hair, just in case he were to lose it. Some of the risks of doing it this way is that you can cause more significant shock loss. So going in and traumatizing an area that already has a lot of hair can actually cause some degree of hair fallout in that zone, and that can be temporary or it can be more permanent, especially if you're not on medical therapy. Then it might be more permanent because you're essentially causing local trauma in that zone. So you do want to do some degree of blending into the existing region that has hair, but this to me is a bit more extensive of a blend than I usually do.
After this, the doctor explained the procedure takes about 6 hours, and if Juan wanted, he could take sedation medication where he could still stay awake, but the best part is that you don't feel the pain.
Even if you're taking the medication, which may have been something like a Valium or an Ambien, you're not fully out, right? So you still feel some of the discomfort that comes with the numbing shots, right? It's not like it completely, there's zero pain. You still feel something, and then once it's numb from the numbing shots, then you should be pretty good to go.
Now here is the timeline for a hair transplant. Once you get your hair transplant, all those follicles you just transplanted, they will fall out in 2 months. So in 2 months, it's called the shedding period.
Some people see the fallout happen closer to 5-6 weeks, and other people much earlier.
They would then start to regrow immediately between months 3 to 6, which is where Juan is at now. He is about 4 months post-surgery, and his hairline looks phenomenal. And your final hairline is gonna come in 12 to 15 months after procedure. From there, we went to my favorite part, I got to shave my bro's head.
That's a pretty accurate depiction of the recovery process. So many clinics will shave the entire head once the markings are complete. There are ways, however, of doing no-shave FUE, and that can apply to the donor area, and it can also apply to the recipient area, and we've talked about that in other videos. And in my clinic, I offer no-shave FUE up to about 1,500-1,600 grafts because it's a more labor-intensive, time-consuming process. And at the recipient area, we're able to work around the existing hair most of the time without having to shave all of this. But there are cases where we highly recommend to shave so that we can get even more accurate with our graft placement.
And as you can see, it's a significant amount of coverage.
So it looks like they marked out the temples, but I'm not sure exactly if they plan on grafting the temples at all. It looks like they've just basically marked where they are. I'm not sure if they're going to actually go in there with grafts. We'll have to see.
The procedure ended up being around 7 hours to transplant 4,000 hair grafts.
So they really did go for 4,000 grafts. And in my opinion, that's way too many grafts for the area that was being transplanted. I don't feel like they had to go as far back as they did. And at that degree of density, while that is good density, you've now exhausted more than 50% of your donor supply. And now imagine that area is still quite a small area relative to the full potential loss that he could experience back to the crown. And you just won't have enough grafts to fill that area in. And if all that he's left with is this strip, it's not going to look great overall down the road. So you have to be careful with graft management over time. And so I do believe in doing the least amount of grafts necessary to still create a great result. So for a case like his, if we even went that low as far as the hairline design goes, I think the most I would have done would be up to maybe 2,000 grafts. And even then, that's kind of pushing it. So, 4,000 grafts, in my opinion, here was a bit much.
After what felt quite like an eternity, he finally came out. I got to talk to him. He was fully conscious after the surgery.
I'm looking here, and it doesn't seem like they actually grafted the temples. They went at the hairline, and then they curved around that frontotemporal angle, and then they kind of stopped there. So that's what I was expecting them to do based on their markings, but this kind of confirms it.
The interesting part is after just one night of rest, he was completely back to normal the next day.
I actually had a bit of a headache last night.
Some clinics will give you this kind of headband to try to keep the swelling out. The truth is that the swelling will still descend down the face in the first week. My thought on it is that it increases the risk of potentially rubbing a graft out because he may, inadvertently bump up the headband and then look how close the grafts are to it. So I prefer not to leave anything on the forehead for patients, and they do just fine. Also, even though he may look absolutely fine the day after, the swelling takes about 2 to 3 days to build up, and then over the next 4 or 5 days, the swelling is coming down the face and then it dissipates. So you could look great the following day, but then several days after that, you can start to look more swollen.
In fact, we were on a flight back home that same day. That next day after surgery, we were already going back home. He was feeling good.
Most patients who visit us from other states, other countries, find that it's helpful for them to stay an additional night, so 2 nights post-op before they fly back. They just feel much more comfortable for the travels back.
Juan spent a total of $6,190. Now, this might sound like a lot of money, but in reality, that's insanely affordable. When you compare the exact same procedure with getting it done in America with no travel costs, a hair transplant surgery will cost you anywhere between $8,000 and $18,000.
Yeah, there's no doubt that price is going to be very different. Cost of living is different. My education is different, in terms of the cost of it. There's lots of differences. But what I'll say again is that regardless of where you go in the world or which clinic you end up in for a hair transplant, you want to make sure that there's proper strategy, that there's a discussion of how many grafts you potentially have over your lifetime to give and how many of those grafts are being invested into the recipient area. And is the hairline design properly done, naturally done? All of that is the most critical. As much as I know cost seems like, that's what matters the most, it truly, down the road, you can figure out the cost, but, this is a permanent type of result, right? So you really want to make sure that it's done properly.
That price varies so much because it depends on how many hair follicles you transplant. Like I mentioned, Juan got 4,000 hair follicles transplanted, which is in the higher range of what is possible. I believe the max is like 5,000.
Even if you're going to do a 5,000 graft case, as I often talk about on the channel, it's much better to split that into 2 separate surgeries of 2,500 grafts, both for the way that the donor area heals as far as scarring, and also being able to budget grafts over time. You want to see the results of a procedure, especially a larger procedure, before you start to invest more grafts into the same zone or into a new zone. Because imagine you have one surgery that's 5,000 grafts. Now they've exhausted 80% of your donor supply. And what if little grows? What if, you're not happy with the direction, the angulation? You're kind of screwed because most of the grafts from the back of your head have been used up. And I find that many patients that I meet who went to Turkey or other, places, whatever, for a hair transplant, things weren't properly strategized, and so they have fewer options at that point. So get plenty of opinions when it comes to, the hair work, and go with a place that you feel can deliver the quality and that you feel really cares about you as an individual, as a patient over time, not just like getting as much money out of you. You don't want the primary emphasis to be on the financials, in my opinion.
The moment everyone's waiting for. Final reveal. Let me show you this guy's hairline, bro.
All right, bro. You ready to show this? Show them the hair transplant?
I think so. I think I'm ready to do it.
Damn. Yeah.
Bro.
That's better than my hairline.
Bro, yours is perfect.
Bro, look at that hair. That is 3 months of growth. The before and afters, I would do this.
Again, this guy's 35. At 55, maybe he's going to love that hairline. I don't know. But to me, it does look fairly straight across. You see also the density disparity between the area that was bare initially and then the areas that were more full before the surgery. And so into those bare areas, maybe he'll get additional fullness over the next, 6 months plus, and he hopefully will. But there likely will be a density disparity there. So even though he's already had, 4,000 grafts, he probably will still want additional fill-in right here. And again, that might work fine when all of this hair is nice and strong. But what happens if a lot of this starts to go? So you have to be careful with, hairline work.